Hi everyone, this is Taylor Clouse and I am your nutrition expert. Today I wanted to talk about an interesting topic, and that is on the acid-alkaline balance of our bodies. For most of you who have looked into different health topics, this is probably something you have come across, and there seems to be some controversy over it. Some people on one hand say that it's the reason for good health, that you have too much acid in your body, and that for vibrant health, vibrant energy, for detoxification, you've got to get the acidic waste out of your body by eating an alkaline diet. Then on the other hand, we have other people that, like doctors, who say that your body doesn't need to be alkaline. It's got very tight controls already, and there's nothing to be concerned about. So what's the truth? What do we need to know about? Well, I think it's a piece of the puzzle that we should look into. I don't think it's as big of a piece as some people make it out to be, but I do think it has a lot of credit in terms of overall health. And here's why. Really, both sides of the story have some good points. It is true that our blood has to stay in a very narrow pH range. It doesn't fluctuate very much one way or the other. But because of our diets, whether they're acid or alkaline, it does exert an influence on our body. So if we eat foods that are too acidic, or maybe we do a lot of exercising, which develops a lot of acidic waste, our bodies have an amazing ability to deal with that, to alkalize those acidic wastes. But that's where it becomes problematic. There are two main factors I wanted to talk about today, and the way our bodies neutralize those acids. So our first major neutralizer is going to be the mineral calcium. And calcium is very important for our bodies, but it's also very alkaline. So if our body senses that our blood or other areas of our body are becoming too acidic, it's going to leach calcium out of the bones and teeth in order to buffer it. And so this can be really problematic over time, that because of this acidic burden, our bodies will stay in the right pH range, but the effects, the shifts within our body, the effort it has to go through, will cause some negative effects and can ultimately lead to problems such as osteoporosis. High calcium intakes, if they're not countered with an alkaline diet, do not help the situation. The other buffer that we have is the amino acid glutamine. Glutamine is very efficient at removing acidic waste, but our stores of glutamine reside within our muscles. So in order to use glutamine, our muscles have to be catabolized, and again, glutamine has numerous health benefits, even so far as our immune system. So using glutamine to counteract acid in our body is just inefficient and a waste. So we want to alkalize our body. So in practical terms, what can we do? Well, first off, we need to incorporate more alkaline foods, and we need to reduce some of the acidic foods. And you can easily go on the internet, you can look up a food list of alkaline foods and acidic foods and make some better food choices. I'll put some links in below, but mainly what you need to keep in mind is look for a list that's called PRAL, or PRAL. That's going to be your most accurate food list at this time. But a couple of simple tricks. The main foods in our diet that tend to be very acidic are grains. So breads, rices, oatmeal, all of those things of that nature tend to be very acidic. And there's also some other ill effects in our health. Gluten and other things while grains are not great. So by reducing our grains in our diet, increasing our vegetables, and again, pretty much all vegetables are going to be in the alkaline area. So decrease grains, increase vegetables. That's a great avenue to go to. As far as grains go, one that tends to be alkaline, if you haven't tried it already, is quinoa. Quinoa can make a great replacement for rice, for oatmeal. You can make warm breakfast cereals out of it. And the other thing I would be concerned about is the amount of cheese. Cheese is very acidic, and one of those things you don't really need in your diet. So eliminating some of the cheese, some of the dairy out there, increasing vegetables can go a long way. Now, you'll probably notice when you're going through and looking at some of these lists that protein tends to be on the acidic chart. And you're absolutely right, protein is acidic for the most part. But we're not going to be too concerned about that right now, because while protein is acidic, we do need some acid in our body. We can't eat all alkaline food. But protein is kind of an anomaly because it contains that glutamine that we need to counteract the acid. So while it is somewhat of an acid load, it also helps us get rid of acid. So because we need protein, go ahead and eat it. But one little trick, we've talked about this before, but good quality grass-fed whey protein. It's really a great superfood. And on the PRAL chart, you'll notice that it is an alkaline protein, just slightly, but it is alkaline. And that can make a big difference in your acid load, considering most proteins are very, very acidic. So there you have it. Hopefully that gives you a good basic formula for acid and alkaline balance. Go ahead, eat more vegetables, eat more fruits, reduce your grains, and eat more grass-fed whey protein. So there you have it. Hopefully it was useful for you. I'll close this out and just thank you. Again, this is Taylor Clouse, your nutrition expert.